Imagine your plate as a puzzle, and each food group represents a piece. To complete the puzzle and create a picture of optimal health, you need all the pieces in the right amounts. That's where Dietary Reference Intakes, or DRIs, come in. Think of DRIs as your personal guidebook to eating right. They provide science-backed recommendations for the amount of vitamins, minerals, and other essential nutrients your body needs daily. By following these guidelines, you ensure your body gets the fuel it needs to thrive. DRIs are not about restriction, they're about making informed choices to nourish your body effectively. Whether planning meals, grocery shopping, or simply deciding what to eat, understanding DRIs empowers you to make healthier decisions. These guidelines consider factors like age, gender, and life stage, recognizing that nutritional needs vary from person to person. By following DRIs, you invest in your long-term health and well-being. These guidelines help prevent nutrient deficiencies, reduce the risk of chronic diseases, and support overall vitality. Think of DRIs as your roadmap to a healthier, more energized you.
DRIs are like a toolbox with each component serving a unique purpose. These components work together to provide a comprehensive picture of your nutrient needs. The four main components of DRIs are recommended dietary allowance, or RDA, adequate intake, or AI, tolerable upper intake level, or UL, and estimated average requirement, or ER. Each component plays a crucial role in guiding us toward optimal nutrient intake. Let's explore each of these components in detail. Understanding the differences between these components is essential for interpreting and applying DRIs effectively. These components are interconnected and provide a complete picture of your nutrient requirements. Remember, DRIs are not a one-size-fits-all approach. They vary based on factors such as age, gender, life stage, and overall health status. Let's delve deeper into each DRI component to understand their specific roles in maintaining good health.
RDA, or Recommended Dietary Allowance. Think of it as the gold standard. It represents the daily nutrient intake level sufficient to meet the needs of nearly all healthy individuals, about 97 to 98%, in a particular age and gender group.
It's like having a target to aim for when it comes to your nutrient intake. For example, the RDA for vitamin C for adult men is 90 milligrams per day. This means that consuming 90 milligrams of vitamin C daily is likely to meet the needs of almost all healthy adult men. RDAs are based on rigorous scientific research and are designed to prevent nutrient deficiencies. Meeting your RDAs for essential vitamins and minerals is crucial for maintaining optimal health and preventing chronic diseases. However, it's important to note that RDAs are not minimum requirements. They represent the average daily intake level that is sufficient for most people. Individual needs may vary, and it's always best to consult with a healthcare professional or registered dietitian for personalized recommendations. In some cases, there may not be enough scientific evidence to establish an RDA for a particular nutrient. In such situations, an adequate intake, or AI, is set. The AI is an estimate of the average daily intake level of a nutrient that appears to be adequate for maintaining good health. AIs are based on observations of nutrient intake in healthy populations and are used when an RDA cannot be determined due to limited scientific data. For example, the AI for vitamin K for adult men is 120 micrograms per day. While AIs are not as precise as RDAs, they still provide valuable guidance for nutrient intake. It's important to aim for the AI for nutrients that have an AI established, as it's the best estimate available for maintaining good health. AIs are subject to change as more research becomes available. As scientific understanding advances, AIs may be replaced with RDAs, providing more precise recommendations for nutrient intake. Consuming excessive amounts of nutrients can be harmful. That's where the tolerable upper intake level, or UL, comes in. The UL is the highest daily intake level of a nutrient that poses no risk. Think of the UL as a safety limit for nutrient intake. It's the maximum amount you should consume without risking toxicity. For example, the UL for vitamin C for adults is 2,000 milligrams per day. Exceeding the UL for certain nutrients can lead to health problems. Unlike RDAs, AIs, and ULs, which focus on individual nutrient needs, the estimated average requirement, or ER, is used to assess the adequacy of nutrient intake for a group of people. The EAR is the average daily nutrient intake level estimated to meet the requirements of half the healthy individuals in a particular life stage and gender group. EARs are primarily used by researchers, policymakers, and public health professionals to evaluate the nutrient adequacy of populations and develop nutrition programs. For example, the ER for iron for adult women is 8 milligrams per day. ERs are not intended for individual use. They do not provide sufficient information to determine if an individual is meeting their nutrient needs. Individual requirements may vary significantly, and relying solely on ERs could lead to inadequate nutrient intake. Understanding ERs is crucial for public health initiatives aimed at improving the nutritional status of populations. By monitoring ERs, health professionals can identify nutrient gaps and implement strategies to address them.
EAR serves as a scientific foundation for setting RDAs. Understanding the different components of DRIs empowers you to interpret nutritional information accurately. These values provide a comprehensive framework for achieving a balanced and health-promoting diet. Now that you understand the components of DRIs, let's explore how RDA, the cornerstone of these guidelines, translates into practical meal planning. Imagine you're planning your breakfast. You want to ensure you're getting enough calcium, crucial for strong bones and teeth. The RDA for calcium for adults is 1,000 milligrams per day. A cup of milk provides roughly 300 milligrams of calcium, while a cup of yogurt offers around 400 milligrams. By incorporating these foods into your breakfast, you're well on your way to meeting your daily calcium needs. The same principle applies to other nutrients, such as iron, essential for carrying oxygen throughout your body. The RDA for iron varies depending on age and gender. Adult women need around 18 milligrams of iron daily, while adult men require 8 milligrams. By incorporating iron-rich foods like lean meats, beans, and lentils into your diet, you can meet your daily iron requirement and support healthy blood function. While RDA plays a central role in guiding our dietary choices, AI, UL, and ER are equally important in achieving a balanced nutrient intake. Consider vitamin K, essential for blood clotting. Due to limited research, an RDA for vitamin K has yet to be established. However, an AI exists, providing a benchmark for adequate intake. Leafy green vegetables such as spinach and kale are excellent sources of vitamin K, helping you meet your AI and support healthy blood clotting. On the other hand, excessive intake of certain nutrients can be detrimental. Vitamin A, crucial for vision and immune function, has a UL. Consuming excessive amounts of preformed vitamin A, found in animal products and supplements, can lead to toxicity. The UL serves as a reminder to consume vitamin A within safe limits, emphasizing the importance of a balanced diet. While EAR primarily serves as a scientific basis for setting RDAs, it highlights the concept of individual variability in nutrient requirements. Understanding the role of AI, UL, and ER alongside RDA empowers you to make informed dietary choices that support your unique needs. DRIs are not just abstract numbers, they have real-world implications for our daily dietary choices. From choosing breakfast cereals to selecting supplements, these guidelines influence our decisions, often without us even realizing it. Many breakfast cereals are fortified with vitamins and minerals, including iron, folic acid, and vitamin D. These fortifications aim to help individuals meet their daily nutrient requirements, particularly those who might not consume enough nutrient-rich foods. The fortification levels are often determined based on DRIs, ensuring consumers receive an adequate amount of essential nutrients. Similarly, when choosing a multivitamin, DRIs can guide your selection. Look for a multivitamin that provides a balanced profile of essential vitamins and minerals, aligning with the RDAs or AIs for your age and gender group. This ensures you're supplementing your diet safely and effectively, avoiding excessive intake of any single nutrient. Following DRIs is crucial for achieving and maintaining optimal health. These guidelines provide a roadmap to navigate the complex world of nutrition, ensuring your body receives the nutrients it needs to function correctly. By following DRIs, you reduce the risk of nutrient deficiencies, which can lead to various health problems. For example, insufficient iron intake can result in iron deficiency anemia, characterized by fatigue, weakness, and pale skin. Adhering to the RDA for iron helps prevent this condition and supports healthy blood function. Moreover, following DRIs contributes to long-term health by reducing the risk of chronic diseases. Consuming a balanced diet that aligns with DRIs can help prevent conditions like heart disease, type 2 diabetes, and certain types of cancer. DRIs empower you to make informed choices that support your current and future well-being, promoting a healthier and more vibrant life.
DRIs are not static, they change throughout our lives. From infancy to adulthood, pregnancy and lactation, our nutrient needs evolve, and so do the DRIs. Factors such as growth rate, body size, and physiological changes influence these variations.
Infants and young children have increased nutrient requirements to support their rapid growth and development. Their DRIs reflect these needs, emphasizing nutrients like protein, calcium, and iron, essential for building strong bones, muscles, and a healthy brain. As we age, our metabolism slows down, and our nutrient requirements may change. For instance, older adults need more calcium and vitamin D to maintain bone health and prevent osteoporosis. DRIs provide age-specific recommendations, ensuring individuals of all ages receive the appropriate nutrient intake.
Pregnant and lactating women have increased demands for certain nutrients to support the growth and development of the fetus or infant. For instance, iron requirements increase significantly during pregnancy to accommodate the expansion of maternal blood volume and the developing baby's needs. Understanding these variations in DRIs across the lifespan is crucial for ensuring adequate nutrient intake at every stage of life.
DRIs play a vital role in public health by providing a framework for preventing nutrient deficiencies and promoting overall well-being. Fortification programs guided by DRIs have successfully addressed nutrient deficiencies in many populations. Fortifying staple foods like salt with iodine, for example, has significantly reduced the incidence of iodine deficiency disorders, particularly in developing countries. DRIs also serve as a valuable tool for healthcare professionals in assessing and managing their patients' nutritional status. By comparing a patient's dietary intake with DRIs, healthcare providers can identify potential nutrient deficiencies or excesses and recommend appropriate interventions. By promoting a balanced and adequate nutrient intake, DRIs contribute to a healthier and more productive society.
Remember, DRIs are not meant to be followed rigidly. They provide a framework for healthy eating, but individual needs may vary. It's always best to consult with a healthcare professional or registered dietitian for personalized advice. By incorporating the principles of DRIs into your daily life, you can make strides toward achieving a healthier and happier you. Remember to focus on a balanced diet, regular physical activity, and mindful eating practices. DRIs are not just about numbers. They're about making choices that support your overall health and well-being. Use them as a guide to nourish your body and live your best life. While DRIs provide valuable guidance for nutrient intake, they are just one piece of the puzzle when it comes to healthy eating. A balanced diet that includes a variety of foods from all food groups is essential for overall health and well-being. Focus on consuming whole, unprocessed foods as much as possible. These foods are packed with essential nutrients, fiber, and antioxidants that support optimal health. Limit your intake of processed foods, sugary drinks, and unhealthy fats, which can contribute to chronic diseases. In addition to a balanced diet, regular physical activity plays a crucial role in maintaining a healthy weight, reducing the risk of chronic diseases, and promoting overall well-being.
Dietary Reference Intakes, DRIs, are your allies in achieving optimal health and well-being. These science-backed guidelines provide a roadmap for consuming the right amounts of essential nutrients, ensuring your body has the building blocks it needs to thrive. From planning meals to making informed food choices, DRIs empower you to take control of your nutrition. By understanding the different components of DRIs, RDA, AI, UL, and EAR, you can interpret nutritional information accurately and make choices that support your unique needs. Remember that DRIs are not about restriction, but about nourishment. They are a tool for creating a balanced and enjoyable dietary pattern that supports your long-term health and vitality. So embrace the power of DRIs and embark on a journey toward a healthier, more vibrant you.